Hi, we're here with Dr. Felicity Goodyear-Smith at the Royal New Zealand College of GPs conference in Auckland, and I'd like to welcome you here, Felicity. And we're talking about your research that you're doing, and can you explain that a little bit to us?
Well, this is part of a big project that I've been working on for about 10 years, really.
Oh, wow, yeah.
So it's looking at a sort of more systematic way to screen for mental health and lifestyle issues, and also see what people actually consider as a problem and what they'd like to work on, because often these things are interrelated. And so we have this tool that I developed called, originally the case finding and help assessment tool, the chat, which is now an electronic tool.
Oh, nice.
So it's now eChat.
Yeah, I have heard of it.
Yeah, okay. And so now we have Youth Chat, which is a youth version.
Wow.
So when we worked with some schools, they said they really wanted to add sexual health to it. So we've added questions on concerns about your sexual orientation, risky sexual behaviour that might cause pregnancy or STIs, and also then sexual abuse.
Wow.
And the youth version also has a different secondary screening tool for drug and alcohol, because with this tool you get asked things about your smoking, drinking and other drugs, anxiety, depression and a few other lifestyle issues. But if you're yes, then it automatically goes on and it does the PHQ-9 for depression, does the GAD-7 for anxiety, and it did the assist, which is a WHO tool for substance misuse. We've replaced that in the youth version with the SACS, which is a New Zealand tool developed by Grant Christie, a child psychiatrist here, that's validated for youth.
Okay.
So that's the youth version. So we wanted to pilot it. And we piloted in a school clinic that also serves other youth who are not at school. So it's a co-located clinic, and it's almost exclusively a Maori population. So we did this over the summer with a summer student, and so she went up to the school. She worked with the school because it not only screens, the young people will enter the answers to the screening tool on an iPad, but then when they go in to see the GP or the nurse, they get a summarised report so it's very quick for them to see, and then she start the conversation about, I see that you're drinking this amount, and that you do want help with it, and then we have step care decision support that actually has been partly material that we provided, but then also that the school clinic and the community have provided. So all the resources of the local community where you might be able to refer people. So it's a co-design approach.
Oh, very good. And so when the students fill in the questionnaire, is that off their own bat, or were they encouraged to do it by the nurses? How does that work?
They're invited by the receptionist.
Oh, wow.
In this particular clinic, I don't know how the summer student managed it, because she's a very sweet young girl. She got 100%. Every single youth that went in there actually did it. So she then interviewed them when they came out. They did a short interview about how they found it, whether they'd made any differences, whether they'd talked about it with the doctor. And she also got a small group that she did a focus group with later on. And they were incredibly positive. There were a few negatives, but most of them they were saying, it made me think about things, made me realise I could take this to the doctor. It actually helped me talk about it, because I couldn't really bring it up. This has been found before, but it's young people particularly, they find it easier to relate online than they do to actually face-to-face with someone saying, tell me about your drinking.
You have to be brave to do it for a person, but on a...
Yes, you can do it. And the GP and the nurse, actually, they were also interviewed at the end, and they said we found things that we couldn't ever have picked up otherwise, because we don't have the time as well, but also they brought things that we didn't know about.
And how do you see this working in normal general practice?
Well, we have got it already working in some normal general practices, and every practice can do it differently. So you can, you could screen all your new patients. You could tag the sort of patients you want to screen. You could do every patient every 2 years. But one general practice that has a high drug and alcohol and mental health, they screen every patient every time. But it's a bit excessive. But it's very quick. And it actually gives people something, and that's what the other thing the young people said, something to do while they're waiting.
Absolutely.
They would have preferred it to look better, like they would have liked some fancy graphics and things like that.
I'm sure that's true. Well, that's great. It sounds exciting, and I'm sure that as it spreads out into general practice, it will be a really useful tool. So great chatting to you.
Thanks
very much. Okay.